I had a big scare last week. I had pain and swelling in my legs. At first I hesitated to call my oncologist. If it was nothing, I would feel like I was crying wolf. But I had to follow my own advice. As a patient advocate, I always insist people call their doctor with any changes they notice. When I did get to his office, he insisted we test to ensure that I hadn't developed blood clots, which was an issue when I was initially diagnosed with metastatic cancer. Fortunately, an ultrasound of both legs revealed no signs of clotting. I can't tell you how relieved I am. Blood clots an ongoing threat, and I was diagnosed with stage 4 breast cancer. I was surprised to learn that there was an even more deadly complication that came with it: deep vein thrombosis, DVT, a condition in which a blood clot, or clots, develops in the deep veins of the body. While in the hospital awaiting surgery to stop bleeding into my lung, a preoperative CT scan showed that I had a blood clot in my lung, also called a pulmonary embolism. An ultrasound showed I also had blood clots in both of my legs. DVT is a deadly and silent killer all by itself. Little did I expect that cancer had brought it along as a sidekick. It was pretty scary. I thank God every day for all the providers who worked hard to save my life. Developing blood clots has continued to be a threat throughout my treatment. You would think that as a nurse I would be able to recognize the symptoms of DVT in myself. But although I had assessed patients for their risk, my symptoms at the time were just not typical of DVT. Yes, just prior to finding out that the cancer had returned and metastasized, I had pain in my feet. But as a nurse working 8 to 16-hour shifts, I felt I had an excuse. Besides, there was none of the swelling, redness, or warmth that often accompanies DVT. When I was finally diagnosed, there were so many other problems that the symptoms in my legs just didn't seem so bad. However, I now warn other cancer patients and survivors about the risk of blood clots, better known as deep vein thrombosis. No symptom can be ignored. Like me, many cancer survivors hate to be a bother to their doctors, but we can't ignore the smallest symptoms. Cancer is an insidious enemy. It strikes terrible blows and seldom announces itself. It is up to us to stay vigilant and advocate for ourselves with our doctors. Nothing can be ignored. Often cancer isn't the thing that kills us, it is something that cancer has caused, a deadly sidekick. I am blessed with an oncologist and other providers who really listen to me when I have a complaint. I try to be gracious, respectful, and grateful for their care. They are my partners in this, and I know they take it seriously. But really, as cancer survivors, we are in the battle for our lives. Every symptom counts, and we need to pay attention. My doctor thanked me for bringing this to his attention, even though in the end there was nothing to be concerned about. I just love him. Photo credit, Alamy.